Hi, everybody. I'm Dr. Malcolm Butler. I'm a family physician at Columbia Valley Community Health, and I'm also the health officer for Chelan and Douglas counties. And I appreciate you taking some time to visit with me today. This week, I want to talk some about the COVID-19 vaccine. Obviously, they've been all in the news, and we've actually started vaccinating people in our valley just this week. So we have received less than 1,000 doses in this first batch, and we should be receiving additional doses going forward. We're not exactly sure when they're going to come or what volumes we're going to receive, but we do know that the first doses are going to be used for frontline healthcare providers, healthcare workers, and also first responders. After that, the vaccines will be provided to residents of long-term care facilities, so nursing homes, assisted living facilities, that sort of thing. And then after that, to essential workers, which would include educators, folks in the agricultural industry, that sort of thing. So I don't actually know when the vaccine will be available for the general public, but I'm thinking probably early summer timeframe. And so if you're maybe concerned about the vaccine, you're worried about whether it's safe and how it might affect you, the good news, I guess, is you'll have probably 6 months worth of experience with the first line health workers and responders, see how they did with it before any vaccine becomes available for you to use. So I want you to know that I have been keeping tabs on the vaccine, the development, how it's been evaluated, and how it works. And I have great confidence in the quality of this vaccine and in its safety. And I want you to know that as soon as I can, I'm going to be sort of first in line to get vaccinated, because I think it's super important. And frankly, I'm kind of scared of COVID. So let's talk a little bit about how the vaccine works, because it's actually very cool. So this vaccine is what I would call hypermodern. It is called a messenger RNA vaccine. And this is relatively new. A couple of them already exist. But this type of vaccine is actually possible now because we've gotten so good at sequencing DNA. So over the last 5 to 10 years, we've sorted out the genome, and we've got machines now which can build essentially DNA type of molecules. So it turns out actually that using those machines, we can now create a vaccine more rapidly than the old-fashioned kind, where we used to have to take a virus and grind it up and find the right part that we could use. So this hypermodern vaccine, what we do is, in a laboratory using chemicals, we build a strand of messenger RNA. So it's important to realize this is being constructed completely de novo in a laboratory. There are no parts of the COVID virus that are used in this vaccine. None of the virus is used, completely built in the laboratory. So messenger RNA, if you don't remember your biology, messenger RNA is like a recipe. And this recipe, if you give it to a cell, it tells the cell how to create a protein. And so what this vaccine does is the recipe is essentially injected into your muscle. It's taken up by the muscle cells, and then those muscle cells start reading the recipe and they start building the protein. And what we've done is we selected those spike proteins, they're called. And if you've seen pictures of the virus, it's got all those spiky things on the outside. So we took that protein, and now we have your muscle cells start producing that. And what happens is your immune system sees those spike proteins and says, wait a minute, those don't belong inside this body. And your immune system revs up and gobbles up all of those spike proteins that have been created. And in doing that, it develops a memory of what those spike proteins look like. And it goes hunting around your body looking for more of those spike proteins that it can destroy. So the good news is, because now it's been revved up and it understands what a spike protein looks like, if you inhale the COVID virus and your body sees that virus with those spiky proteins, it's going to gobble it up and it's going to destroy it. So it's a very cool process. And it turns out it's actually more effective. So this mRNA is more effective, a more effective type of vaccine than the average vaccine. So it's like 95% effective. But there are some complications. So it turns out that if we just inject the messenger RNA, if we just inject the recipe card into your body, your immune system will see the recipe and say, wait, this is bad, this doesn't belong here, and it'll gobble up the mRNA. So we had to find a way, we had to put an invisibility cloak over the recipe card, over the mRNA as we injected it, so that it could get inside the muscle cell without being destroyed. So what we had to do was we had to wrap the mRNA in a little bubble of oil. So we took the natural fats that happen inside a body and we wrapped the mRNA in a bubble of oil. And that's called a lipo-nanoparticle. So what we're actually injecting into you are a whole bunch of lipo-nanoparticles, inside of which are these little mRNA molecules. And these lipo-nanoparticles get inside the muscle cell, and then the oil is sort of just absorbed inside that cell, and it reveals the recipe. And so that coating of oil is the invisibility cloak that gets the mRNA inside your body without being destroyed. So you can imagine oil melts really easily, right? It breaks down super easily, which is why these vaccines have to be kept very, very cold. In fact, they have to be kept at negative 94 degrees or 94 degrees below zero, 94 degrees below zero, which is way colder than, you know, your standard refrigerator or freezer. So there's some logistical complications about how we're going to receive the vaccine and keep it that cold and move it around the community and hand it out to the people who are doing the vaccinations, just because it's sort of fragile because of those lipo-nanoparticles. Anyway, super cool virus, created entirely in the laboratory. No part of the COVID virus is involved, but there are some logistics around that oil coating that we put around it. So another thing is, because this is such an effective mechanism for revving up your immune system, there are side effects. So after the injection, most people have some pain in the muscle. And then they also, for a day or two afterwards, they feel kind of achy, muscle aches, fatigue, that kind of thing. And I think a lot of people who feel headachy, sore, weak, think, oh my goodness, I've developed an infection. So I just want to clarify, because our whole lives, when we feel icky like that, we say, oh, we have an infection. And actually, it's not a virus or any other infection that makes you feel that way. When we feel that way, that is what it feels like when our immune system is getting revved up. So when our immune system is getting revved up and is super active and making antibodies, we develop soreness and fatigue and achiness and headache and fever. So it is your immune system doing the work that we're asking it to do that gives us those symptoms, what people are calling side effects. It is not because you've been infected, but rather because your immune system is reacting to those proteins that we told your cells to build. Anyway, so don't worry too much about the side effects, they're normal. And in fact, the stronger the response you have, the more achiness and fevers you have, probably the more immune you will actually be. So look forward to a bit of a strong response. So that's my story about the vaccination. Pretty cool. So we got some questions for today, so I'll read through these. The first one is, the FDA approved this COVID vaccine very quickly. How can I trust that this fast tracking of the vaccine means it is safe for me and my family? And I think that's a very common concern. So let's talk about what normally happens. Normally, um, when a company is trying to develop a vaccine, they have to find the virus or whatever is causing, the problem we're trying to solve. They have to isolate it. They have to grow it up. They have to find a part of it which can be used as a vaccine. And then they develop their vaccine. They inject that into 30,000 to 40,000 people. And if it's okay, if those people do fine, they don't have bad reactions or anything, then they have to wait. And they have to wait until the people who are in the trial are exposed to the problem. So for example, things that are really rare, like measles or polio or other things that we have vaccines to, it might take years for that group of 40,000 people to be exposed to polio. And they would need to be exposed to it to prove that they are in fact immune to it. So it used to take years and years and years to develop a vaccine. But this time, it's totally different. What we've done this time, again, I told you about how the vaccine is fabricated using the new DNA sequencing technologies that we now have. So the mRNA was produced very quickly. It was still put into 40,000 people. But because COVID is so prevalent right now in our communities, it only took a couple of months before there were enough people who had contracted COVID in the group who didn't get the vaccine to prove that the 40,000 people who did get the vaccine were immune. So those few things made it possible to produce this much more rapidly. Also, and this is kind of cool, the manufacturers actually started producing millions and millions of doses while they were waiting for those 40,000 people to get exposed to COVID in the environment. So they didn't wait for the final approval before they started production. They started production, and so the production and the trials were going on side by side. The good news, I think, both for all of us and for these companies who have invested a lot of money in producing vaccine was it worked brilliantly. The FDA put everything else aside and reviewed all of the data and approved things quite rapidly over a couple of weeks instead of getting in queue and waiting for weeks and months for approval. So the whole process obviously was fast-tracked. But I am very confident that 40,000 people experienced the vaccine. We know that the side effects are very, very minimal, and we know that it has about a 95% effectiveness. So I am confident that even though this happened rapidly, it's a high quality product. Great question. Sorry, kind of a long-winded answer there. Second question. I heard the vaccine is a way for the government to control the population. Does the COVID vaccine affect my fertility, and what are its side effects? So what I can tell you is that I have spent my entire career working fairly closely with the government. And there is no way that the government is smart enough to create a vaccine that could control anyway. Absolutely. The government can't even control itself. So you don't need to worry that the vaccine is designed for any type of governmental control. Couldn't happen. The government is not nearly smart enough to come up with something like that or to do something like that. The vaccine is not going to affect your fertility. In fact, as far as we can tell, it's safe for women who are pregnant to receive during pregnancy. So you don't need to worry about those things. And then, as I described, the side effects that are most common are tenderness at the site of infection, some weakness, some muscle aches, and some fever. Now, in fairness, we tested this on 40,000 people, and 40,000 is a lot, but it's not 10 million or 40 million. And so we will discover more over time as we vaccinate more and more people. So again, I think if you are concerned about the side effects, if you are concerned about how the vaccine was developed, you should wait. Wait 6 months or wait 10 months to get vaccinated until you have seen what we learn about it going forward and what potential side effects are. Those of us who go into work every single day and confront the virus head on, we're going to get vaccinated right now. But if that's not the type of work you do, and if you're comfortable wearing your mask and waiting, then do that. And we'll know more about this vaccine as time moves forward. Okay, next question. The vaccine is supposed to get COVID under control in our community and our country. How is that going to happen if half the population won't take the vaccine? I guess I'm asking, what's the point of taking the vaccine if my neighbors and coworkers won't get it anyway? And that's a very interesting question. And what you're talking about is this thing that we call herd immunity. And you're right, we need at least 2/3 of the population to get to develop immunity to hit that herd immunity. And herd immunity is when so many people are immune that as the virus jumps from me to you, if you are immune to it, it dies right there with you. It doesn't get spread any further. So when enough people are immunized, the vaccine just can't find new people to infect because everybody is protected. But the other thing to think about is when you get vaccinated, it's going to help you, right? Because, excuse me, after you're vaccinated, if you're around somebody who is contagious with COVID, there's only a 5% chance that you would contract the infection. So you're 95% protected. And this comes on fairly rapidly after that first immunization. The immunization, there are 2 doses, but pretty quickly you get that protection. So for sure it protects you almost right away. Also, as far as we can tell, after you've been vaccinated, it is very, very unlikely that you could infect anybody else. So you could look at getting vaccinated as a way to protect your family and to protect the people you love. And then finally, another thought is, once we have everybody vaccinated, hopefully we can take our masks off. But I suspect that most employers, if you have elected not to get vaccinated, most likely, most employers are still going to require you to wear a mask. So think about that too. If you love wearing a mask, don't get vaccinated. But if you hate, like me, if you hate wearing a mask, get your vaccine. Okay. I read online that if you have allergies, you shouldn't get the vaccine because it could send you into anaphylactic shock. My whole family has allergies, so do I need to worry about that? So again, we're going to know a lot more after we vaccinated several million people, right? But in the first few weeks of vaccinations, there have been some cases of a couple of people who had an anaphylactic reaction. So an anaphylactic reaction is not like allergies. I mean, if you have allergies to peanuts or to shellfish or to bee stings, and essentially your whole body swells up, your airway closes up, and you could die, that's an anaphylactic reaction. So the common allergies that almost all of us have, like you can hear in my voice right now, runny nose, itchy eyes, scratchy throat, standard allergies, totally different, and you don't need to worry about that. However, the 2 people who had an anaphylactic reaction in England, both of them had a history of having had anaphylactic reactions in the past. And so now we are recommending that if you have a history of anaphylactic reactions, that you not receive the vaccine. Let's wait until we've got experience with 10 million doses, and then we'll kind of know what to do with people who have a history of anaphylaxis. So interesting question, good question, thank you. And that is the last question for today. So I appreciate your spending some time with me. And look forward to doing this in the future, probably after the holidays with you. Thank you.